Hi, it's Brad Truax from Eastman's Woodlands and Wildlife Committee. May is peak tick season for deer ticks, so it's timely that we're doing this presentation on ticks. This is a black-legged tick. This is the one we're most concerned about because in our area, this is the one that's most likely to transmit diseases such as Lyme disease. We're all aware that tick bites can cause an increasing number of diseases because they can transmit bacteria, viruses, and parasites. The most common diseases would be Lyme disease, Powassan disease, babebiosis, Rocky Mountain spotted fever, ehrlichiosis, and a few others. Black-legged tick, or the deer tick, is the vector of Lyme disease in most of the United States. And ticks can't jump and they can't fly. You get tick bites when they crawl onto you when you come into contact with something they're living on, such as grasses or leaves. And they can't bite through clothing. You live at Eastman, so you're going to be exposed to ticks. So it's important that you know how to reduce your risks. Different ticks are associated with different diseases. The black-legged tick, also known as the deer tick, is the most common one here, and it's associated with Lyme disease, Powassan disease, babesiosis, and anaplasmosis. The Lone Star tick, which we seldom see here, is associated with a number of diseases, but also, interestingly, it's associated with red meat allergy, which we'll talk a little bit about later. The dog tick is associated with Rocky Mountain spotted fever. This is showing the black-legged tick. It's pretty small. Again, there's a dime for comparison here. So you can see that even the adult female is not very big, and the nymph is extremely small. So these are hard to see. This is showing the size comparison of the various ticks. The dog tick, which is the one most people are most familiar with, is B here, and it's pretty big. You can see it. The Lone Star tick is a little bit smaller, but almost as big as the dog tick. But look at the black-legged tick or the deer tick. C is the female black-legged tick, and this is the nymph. So they're very small. They're very hard to see, hard to pick up. New Hampshire is a top 5 state for ticks. Deer ticks have 2 high seasons. One starts in March and peaks in May, which is why we're doing this presentation now, followed by a lull in the summer and then a second spike that occurs in October. Dog ticks, on the other hand, have just 1 high season, and that's between April and August with the peak in June. Deer ticks are far more likely to transmit disease than dog ticks are. Climate change has had an impact on tick population and tick-borne diseases. In New England, our winters have been much milder with warmer winters and less snow cover. And ticks aren't killed by cold. Instead, they just become less active. But this year, because it's been warmer in the spring, ticks are more active earlier in the year, and they'll probably be more active later in the year. Bebop Labs is a lab that collects data on ticks in New Hampshire, and they found that 40% of black-legged ticks carry at least one disease, such as Lyme disease, and about 7% of the ticks, black-legged ticks, carry more than one disease. So where do ticks live? They live in warm, moist places. So especially at the interface where lawns meet the woods, and we'll talk about that later, that interface between the forest and your lawns is a very important interface. There's a 3-meter, actually it's about a 3-foot boundary closest to the lawn's edge that are a tick migration zone. And 82% of the tick nymphs are found at lawns there. They also live in long grasses, shrubs, and bushes, and moist leaf litter with an overstory of trees is a favorite place for them to live. Black-legged ticks are far more numerous in the woods than they are in grasses. And there are animal vectors that are important. These ticks live in deer, rodents like white mice, skunks, fox, bobcats, etc. And again, you live at Eastman, you live in the woods, you hike, you golf, you're going to be exposed to ticks. This is just a diagram showing important areas. Ticks would be out here in the forest. It's important that you build this kind of a buffer area that you could do with wood chips or with stones, roughly about a meter or 3 feet, and then have another 9 feet of grass in between before you get to your living space. More about that later. Ticks do not run after us. They climb up on the vegetation and they basically wait for us to walk by, and then they grab on when we do walk by. Deer ticks do not eat native plants, leaf litter, or brush piles. Ticks stay in brushy areas because they need the high humidity. And deer ticks do eat mammals, at least for their blood, and two of their favorites are the white-footed mice and the white-tailed deer. Okay. Remember I said ticks can't fly? Well, they really can't fly, but a research study shows that static electricity allows them to jump and latch on. Here's a tick crawling along. All of a sudden, there's some static electricity, and he jumped up there. Incredible. Black-legged ticks favor the white-footed mouse and the white-tailed deer. Simplified landscapes that harbor only white-footed mice and deer have very high rates of infectivity. So we should try to make a landscape in a way that encourages higher mammal diversity. So areas that have foxes, chipmunks, squirrels, raccoons, groundhogs, and possums have much lower rates of Lyme disease, not because they have any fewer ticks, but because those mammals are dead-end hosts for Lyme disease. So understanding tick migration zones can help you landscape and design areas around your home to reduce the probability of exposure to ticks. I mentioned that 3-foot barrier separating the forested areas from living areas is important. So you can use wood chips or rock to create such a barrier in that zone. And then a further 9-foot barrier of lawn should separate that wood chip barrier from your play areas, your gardens, your patios, etc. And play sets like swings and slides and so on should be located in these safer areas, and importantly in sunny areas. And that's because ticks have difficulty surviving in dry, sunny areas. Many commercial companies can treat the perimeter with pesticides that kill tick and mosquitoes as well. And this is just showing that typical zone we talked about. Here's your 3-foot zone adjoining the forest. Here's the 9-foot zone of lawn. And again, here's your swing set or your play set that's out in the sunshine. Here's your garden. You might have a patio back here as well. And these are things you can do in your property to minimize your risk of exposure to ticks. So how do you avoid tick bites? Well, first of all, if you can avoid areas where you expect ticks, you can do so. But again, here at Eastman, we like to go in areas where ticks may be present. So they may be present on our hiking trails. They may be present on the areas adjacent to the golf course. So you should wear light-colored clothing so that you can easily find the ticks. There's nothing magic about light-colored clothing and attraction of ticks. It's just much easier for you to spot them if you're wearing light-colored clothing. But you should wear long sleeves and long pants. And again, you should tuck your pants into your socks, or you could wear gaiters if you're walking on some of the trails. And you can use permethrin on your clothing and shoes when you're going into areas that are likely to have ticks. And there's also permethrin-treated clothing that you can purchase. One word of caution, though, if you use lots of permethrin, there apparently some new data suggests that there might be a higher mortality in people with very high pyrethroid exposure. You could also spray your exposed skin with DEET containing insecticides. Would be DEET 20% or greater. But again, in children, you have to be aware not to use more than 30% DEET. And you should do a tick search every time after walking in areas likely to have ticks. Search your pets for ticks before you let them in the house, and know how to best remove any ticks that do bite you. Are you a golfer? Okay, when it's warm, you probably don't wear long sleeves and long pants or tuck your pants in your socks when you're golfing, Eastman. If you're like me, you probably hit some balls in the woods and you likely leave the fairway to go search for your ball. Those are areas in the woods that are just off the fairway that have lots of leaf litter. And moist leaf litter is a great home for ticks. I've sometimes found as many as 4 to 6 ticks on my exposed skin after looking for a golf ball merely a few yards into our woods. So you got to be very careful. So make sure you search for ticks when you've looked for your ball in the woods. Do a tick search again after walking in those areas and look for ticks all over your body, even on your back and your neck, along your hairline, your groin, even your butt cheeks. These are favorite areas for ticks to find a spot to bite you. Deer ticks especially like bare patches of skin near the waist and sock bands or tight undies, and they may even go between your toes. Search your pets for ticks before you let them in the house. I recommend you remove your clothing and place it in a hot dryer for at least 20 minutes if possible after walking in areas where ticks are likely. And if you can't place your clothing in a dryer right away, you can place it in a sealed garbage bag for later drying. Should take a shower and then look for more ticks. And if you find a tick, use tweezers to remove the tick by grasping the tick as close to where it's attached as possible. We'll show that in a minute. After that, you wash the area with soap and water and maybe a mild disinfectant or an antibiotic ointment. And you may want to save the tick. I'll talk about that in a minute as well. Are you a tick magnet? There are specific traits that make certain people more attractive to ticks. Hot, hairy, heavy breathers tend to be tick magnets, and that's because ticks are attracted to both heat and carbon dioxide. So people with higher body temperatures and those who are exhaling forcefully are at greater risk. And those people with hairy legs and arms are also perfect leg holds for ticks. Okay, the ticks grab onto the hair in those areas as you brush past them in the woods or at the edge of a field. And there's probably also an X factor. Some people release greater amounts of a chemical pheromone called butyric acid, and that also attracts the ticks. So I'd much rather be a tick magnet than a tick magnet. So how do you remove a tick? In most cases, a tick has to be attached for 36 to 48 hours before Lyme disease bacterium can be transmitted. So knowing how to correctly remove a tick is very important. Try not to leave the tick's head embedded in your skin. And there are certain myths about tick removal that don't work. Fire doesn't help. Alcohol doesn't help. Nail polish doesn't help. Vaseline doesn't help. So how do you remove a tick? You grasp it with the fine-tipped tweezers as close to the skin as possible, and you pull straight upward with a steady pressure. Do not twist or jerk the tick. After removing the tick, clean the bite area and your hands with either rubbing alcohol or simply with soap and water. Soap and water is probably adequate in most cases. If a tick is still alive once you pull it out, you can kill it by putting it in either rubbing alcohol or placing it in a sealed bag or container. You may want to save the tick for species identification and the degree of engorgement. Remember, we said that for Lyme disease, it's only black-legged ticks that are important. And if they're extremely engorged, that might suggest that they've been there beyond that 24 to 36 hours that's critical for transmission of Lyme disease. So here's a video of how to remove a tick.
There's the old way and the right way to remove a tick. This isn't the right way. Neither is this or this.
Using matches or nail polish remover or Vaseline, you want to avoid those.
Dr. Bobby Pritt is a parasitic diseases expert at Mayo Clinic. She knows ticks and how to properly remove them.
You don't want to squeeze the tick because that could cause it to regurgitate some of its stomach contents into the wound. You don't want to burn the tick. That could also cause it to regurgitate.
Dr. Pritt says the best tool for the job is a fine-tipped forceps or tweezers. Without squeezing the body, use the tweezers to grab near where the tick is attached to your skin.
You would just pinch as close as you can to the bottom of the tick and then just pull it out in a single continuous motion. The goal is to remove the tick as fast as possible without damaging it.
Dispose of the tick in a sealed bag or container, or flush it down the toilet. Then clean the bite area and your hands. For the Mayo Clinic News Network.
There's actually a second way of removing the tick that's very interesting. You can take a Q-tip and wet the Q-tip and then twirl it around the tick several times, gently touching the tick. The tick may dislodge from the skin with its mouthpieces fully intact. And after removing the tick, once again, clean the bite area and your hands with either soap and water or rubbing alcohol. And if it is a live tick, you can kill it either by putting it in rubbing alcohol or placing it in a sealed bag or container. And again, you may want to save the tick for species identification and estimate of its size, because that may determine the likelihood that it might have transmitted Lyme disease. So here's that alternate tick method.
Okay, I'm going to take a video on how to remove a tick that I got yesterday cleaning out my garden. You see it? Look.
Yep. Right there. Just go in circles. A little bit of water. You sure this was on from yesterday?
Yeah.
No, he's not even barely in there very far. Just go around in circles like that. Oop, there you go. See, and then they let go. That's it. Just like that.
A little bit of alcohol.
Wow, that was neat. So that was simply a Q-tip with water on it, and that was a simple way to do it, and probably avoids leaving any bits of the mouth in your skin. So if you're bit by a tick, first of all, don't panic. The key is to remove that tick as soon as possible. And usually you don't need an antibiotic after a tick bite. But if you live in an area where it's known to have a high frequency of Lyme disease, you may want to contact your physician to see whether use of an antibiotic for prophylaxis would be indicated. Also, you'd want to watch for fever, rash, or flu-like illness in the weeks after a tick bite. And other symptoms of Lyme disease may include headache, muscle ache, joint pain, joint swelling. Some people may develop neurological symptoms like facial paralysis. Lyme disease, again, is caused by the bacterium Borrelia burgdorferi, and it's transmitted by the black-legged tick, which is also known as the deer tick. And those ticks reside in deer, and it says white-tailed mice. It's really white-footed mice. Often begins with a classic Lyme disease rash, which is a circular red rash with a central clearing area that slowly expands. So it looks like a target. I'll show you a picture in a minute. And then most people will also have some fever or flu-like illness in the weeks of after the tick bite, followed by headache, muscle pain, joint pain, neck stiffness, and fatigue. And it may affect the joints, the heart, and the nervous system in the later stages of Lyme disease. It may also cause arthritis in the long term. If it affects the heart, it may cause palpitations or an irregular heartbeat. Facial paralysis occurs in some people, so what looks like a Bell's palsy. And inflammation of the brain and the spinal cord are more serious complications. This is showing the classic Lyme disease rash. So it looks like a target. So again, there's a circular area out here, a central clearing, and then redness in the center. So it looks just like a target. But in fact, there are a whole host of rashes that can occur. I'll show you some more of those in a minute. There are certain circumstances where you may want to use an antibiotic for prevention of Lyme disease. So again, you might want to use a single dose of doxycycline, which is an antibiotic, if the tick bite occurred in a state where you know that the incidence of Lyme disease is very high. And you may have to contact your local health department to find that out. But you can presume that we're in an area that probably has a fairly high incidence of infected ticks. The attached tick can be identified. If you may want to consider that antibiotic if the attached tick is identified as a adult or nymphal black-legged tick, so a deer tick, and if the estimated time of attachment was greater than 36 hours. And that would be based upon the degree of tick engorgement with blood or the likely time of exposure. And again, you can start the antibiotic prophylaxis within 72 hours of removing the tick. And you would use this only in a patient who has no contraindication to that particular antibiotic, doxycycline. Those are CDC recommendations. Once again, this is showing the classic Lyme rash, looks like a target, but there are a whole host of rashes that can occur. It may be an expanding red lesion with a central crust. It may be multiple red lesions or a red-blue lesion, a red oval-shaped plaque. But the key thing is you want to watch for associated fever or flu-like illness in the weeks after that tick bite. And this is just showing some of those other rashes that I just talked about. Here's your classic one here, but you can have one that looks like this or like this, and so on. Another disease that can be transmitted by the black-legged tick is babesiosis. And again, this is now endemic in New Hampshire, Vermont, Maine, and Massachusetts. And the symptoms you get with babesiosis are fever, chills, headache, and fatigue. And it tends to be worse and more dangerous in people who are immunocompromised or patients who are lacking a spleen. Powassan disease is probably the most serious disease that's associated with the black-legged tick. And this is transmitted by a virus, and it causes meningitis or encephalitis. So inflammation of either the envelope around the spine or an inflammation of the brain. And the symptoms usually begin between 1 week and 1 month after the bite. And the symptoms are fever, headache, vomiting, weakness, confusion, loss of coordination, speech difficulty, and seizures. And I said this is probably the most serious one, and that's because if you have severe disease, about 10% of the people may actually die. And approximately half the people who survive severe disease also have long-term health problems like recurring headaches, loss of muscle strength, and some memory problems. And keep in mind, because this is a virus, there are no medications that currently are used to prevent or treat a Powassan virus infection. Antibiotics don't treat viruses. It's interesting, there are a couple diseases that are associated with ticks that are non-infectious. One is tick paralysis. It's caused by a neurotoxin that's secreted in the saliva of the tick. And it's due to the bite of the gravid female wood tick. That's the scientific name is Dermacenter andersoni, and that's the most common wood tick in the U.S. In most cases occur early in April, May, or June. In most cases occur either in young girls because long hair is a risk factor, or in men with outdoor jobs. So lumberjacks, people who are out working on trees in the forest and so on. And it presents with an ascending paralysis, which may even produce respiratory paralysis. So it may mimic Guillain-Barré syndrome, which is an autoimmune disease that has an ascending paralysis. And this is one of the few miracles. If you remove the tick, it results in complete reversal of the symptoms, either within hours or days. So you have to be very careful. If you suspect tick paralysis, do a very careful search for that tick, particularly on the scalp and under the hairline. And I mentioned before, it's one of the true miracles that we ever see. Okay, the second non-infectious tick-borne disease is red meat allergy. It's also known as the alpha-gal syndrome. And it follows the bite of the lone star tick. If you remember the lone star tick, that's the one that has that little white star kind of in the middle of the back. And there's certain risk factors for meat allergy after those tick bites. So it's more common in males, in people with a non-B blood type, in people that have a bioprosthetic heart valve, like one that's made from pigs or cows, or if they have pre-existing allergies to gelatin or animal dander. And if you suspect red meat allergy, you would have a special allergy challenge test. And if it confirms you have a red meat allergy, those people would have to avoid not only red meats, but also foods containing gelatin. And interestingly, several forms of intravenous immunotherapy with certain monoclonal antibodies. So this is an emerging threat from tick bites, in addition to the infectious diseases we talked about. It's interesting that tick diseases have more than doubled since 2004. One of the reasons for that, I mentioned before, may be climate change, because our winters are basically milder and shorter. People are more likely to be exposed to ticks, and as a result, they're much more likely to get diseases like Lyme disease. So here are a number of resources that you can go to if you want to learn more about ticks. And key warning is, don't let one tick bite change your life. This is a sign from the Cape Cod Healthcare, which is put out at one of the areas, basically a hiking trail that people might go on. And it basically warns people what to look for: stay on the trail, wear shoes, not sandals, use insect repellents like DEET or permethrin, and always, after outdoor activities, check yourself, your children, and your pet for ticks, and put your clothes in the dryer for 20 minutes. So great warning. We hope that none of you are going to be exposed to ticks, but if you are, do the things we just talked about. So once again, we hope you've enjoyed this, and we will have this posted on the Eastman website, and you'll be able to go to it at some point.